most powerful healing agents for injuries have been available for years. Peptide therapies are the closest things that we have to drug-like strength without the nasty side effects. Choosing to not take advantage of these powerful peptide therapies mean that you will be recovering from your injuries much longer and not doing the things that you love most. My name is Dr. Jones, and I have clinics that service across the nation. We've been prescribing these peptide therapies for over the last 10 years, helping our patients get back to the things that they love most. Peptide therapy is a game changer. I had massive surgery myself about a year ago, and peptide therapy allowed me to heal much faster and get back to my jam this summer, which is volleyball. So you'll see me smashing the net this summer. Peptide therapy isn't a cheap investment though, and we know this, right? So after teaching you the most powerful healing peptides that are out there, I then want to spend the rest of my time in this video teaching you how to implement the best functional strategies so that you can get the best possible results. So let's get into it. Okay, so I'm going to do a little brief kind of overview of peptides, but the best video that you guys can look at if you want a much more comprehensive overview and practical guide, check out the Peptides 101 video, the most practical guide you're going to find online. All right, so peptides have been getting a ton of attention, and you have to understand that they are getting this attention because they freaking work. It's such an interesting space right now because while we don't have enough human studies on these peptides, we really don't have much human study at all. We have this unusual situation where probably at this point, millions of people are reporting amazing results with peptide therapies for healing all sorts of various issues, but we're going to focus today on musculoskeletal injuries specifically. Peptides are actually very common. If you've never heard of them, they exist in our body. Think of them as like hormones. They're just signals that cause certain things to happen on other parts of the body. In this case, the ones that we're going to be talking about promote and speed up and enhance healing. Literally, peptides are small chains of amino acids strung together, and amino acids are the building blocks of protein. So just think of them as small linear chains of proteins. Your body makes them. And so injecting these peptides, because that's the most common form of administration, especially the ones that we're talking about today, we're just enhancing that weakened signal. I love the way that Dr. Seeds explains it. He's known as the godfather of peptide therapy, but he talks about these powerful chemical messengers. This is like the human communication. This is the language of the human body, to quote Dr. Seed specifically. And I love that explanation. It makes a lot of sense. And it also helps us understand why we observe such a lower side effect profile on peptides. Yet when we look at drugs, pharmacological interventions, we notice a much higher side effect profile because these are foreign to the body, also very powerful. But we have something that the body actually recognizes, and we're just enhancing existing language of the body. Okay, so peptides function via injection, many forms of administration, and they enhance that signal, and then we cause a certain response to happen. And today we're going to get into the various ones that I like the most for healing. Okay, so my favorite healing peptide, hands down, has to be BPC 157. Body protection complex. So BPC 157 can actually be found in the human gastric juices. Studies on BPC 157 began as early as 1990s. So this is probably the most well-researched peptide. It's literally found in our gastric juices, and it has many different functions that it's involved with. Angiogenesis, the development of new blood vessels. It stimulates growth factors. It modulates the inflammatory response. Modulate is an interesting word because that refers to the ability to go both ways. So it will increase inflammation if it needs to, but it could also decrease inflammation, which in the case of healing, it's almost always utilizing that component, which is lowering the inflammatory response. BPC 157 has actually been shown to positively impact the neurotransmitter systems too as well to reduce neuroinflammation. So this is big too as well because a lot of us have issues with gut health, and we notice a connection between the gut and the brain. And so poor gut health will lead to some potential neuroinflammation, which can affect our attention and our overall cognitive ability. Now, speaking of gut health, BPC is known for its pristine ability to improve gut. So when we think of the two main things that BPC really is known for, healing of musculoskeletal injuries and improving gut health. And if you have an autoimmune disease, you need to be using BPC 157 because we almost always find gut dysregulation and gut issues in people that have autoimmune diseases and alongside many other people too as well. So BPC 157, powerful for gut issues, powerful for healing. injuries, GI issues, dental, skin, and burn. A long list of potential usage for BPC 157. If we are looking for gut healing, it's definitely better to go with the oral version of BPC 157. And then if we are looking for the systemic musculoskeletal healing benefits, then we go for the injections, specifically subcutaneous injections. And the dose that we like can be anywhere on the low end, 250 micrograms, upwards to 1 milligram or 1,000 micrograms. You would inject this one time a day. And in general, there's this concept of taking some time off of peptides. When it comes to BPC 157, I like an approach of 4 months on, 3 to 4 months on, taking a month or two off, and then continuing on from there, depending on the severity of your injury and how much more progress you need to make. Okay, TB 500 is the next one. And you'll many times see people stacking TB 500 with BPC 157. And I'm a big fan of doing just that. TB 500 is actually a fragment of a naturally occurring peptide in our body called thymosin beta 4. So thymosin beta 4 is actually found in the thymus gland. And what makes this peptide so unique is it's actually involved in the immune system and plays many various roles with helping develop the standard immune response in our body when needed. So what's also another effect of TB500, which we're more interested in, is the extensive research in its regenerative properties and successful wound healing. So TB500 does a lot of what BPC 157 does too as well, upregulating the healing processes, upregulating the cell binding protein and growth factors, promoting angiogenesis, modulating that immune response. But one powerful differentiator, which is why we notice such a synergistic effect when we utilize both BPC and TB500, is the cell migration component. There is a much stronger cell migratory effect from TB500 than you would get from BPC 157. So this is a big deal. And if we have a strong and powerful injury, you're definitely going to want to add TB500 to the stack too as well to promote the best healing. It enhances stem cell differentiation, and we also notice reductions in neuroinflammation. It's a great peptide, and it would be my second in my arsenal because at the end of the day, peptide is, like we talked about earlier, it's an investment. They're not cheap. And so I'm going to give it to you from the basic and then add the peptide that we can stack. So my number 2 would be TB500. Now, TB500 is the dosing is a little interesting. So the dosing ranges from 500 micrograms upwards to 2 milligrams per day. BPC 157 had a range too as well, but this is a much more robust range. So 500 micrograms all the way up to 2,000 micrograms. So you guys might have heard the Wolverine healing cycle. So the Wolverine cycle is touted, and it's always a high dose of TB500 and BPC 157. And we know Wolverines have amazing healing regenerative abilities. And so TB500 on the higher end would be a ratio of about 4-1 or 2-1 ratio. Somewhere around there is a good combination to get the most maximal healing that you can from TB500. The way we approach this, same thing. We cycle on maximum of 4 months and then taking at least a 2-month period off. TB500 would definitely be your add-on. BPC 157, think of that as your base. You can run that year round if you wanted. I know a lot of people do when they have various inflammatory conditions, or maybe they do a 4 to 5 month, 6 month with more of a 1 to 2 month off. TB500, save that for when you have injuries. It would definitely not be one that I'd recommend using year round. It's powerful. It's potent. Use it when you have specific injuries that you're trying to get through it. Give yourself some breaks and only use it when you need it. And that's it. Okay. So number 3 in the powerhouse of peptides to promote and improve healing would be the all too famous growth hormone peptides. So specifically, these are, we call them growth hormone secretagogues. And so what they do is they actually signal the release of growth hormone from your pituitary gland. So we know as we age, growth hormone levels decrease. Growth hormone is stored in the pituitary gland, and naturally the way that your body signals it is via the release of various peptides. They call them growth hormone releasing hormones or growth hormone releasing peptides, GHRHs or GHRPs. And so we now manufacture some peptides that act in the same fashion where they attach to the pituitary gland and stimulate the release of your own growth hormone. this is significantly safer than exogenous growth hormone usage. Exogenous growth hormone can be used. Our clinic stays away from that, but we've just seen a lot of issues long-term with insulin resistance, carpal tunnel, some swelling and inflammatory issues. So I'm a much bigger fan and proponent for using your own growth hormone via the stimulation from these growth hormone releasing secretagogues. So one important synergistic aspect, and it's important to note, BPC 157 actually increases the receptor site density for growth hormone. So this is awesome. And this is well documented, actually. So in essence, you're going to get more out of your growth hormone by having the BPC 157 there. So again, you guys see my order here, BPC 157 first, let's add the TB 500 afterwards, and then let's add the growth hormone peptides to have the most powerful peptide triage that you can have when it comes to healing from musculoskeletal injuries. So looking at some of the more popular ones, we have samoralin, tesamoralin, CJC 1295, and ipamorelin. And just so you guys know, there's going to be a free guide so you're not freaking out about trying to write all this stuff down. There's going to be a link in the description. It's going to be a free guide where you're going to get all these. You're going to get this really cool chart and grid for all your dosing protocols and a lot of other cool information regarding peptide therapy. So you're definitely going to want to get that. Okay, so the BPC 157 increases the receptor site dose. Really, really important why these are so synergistic. So samoralin is a GHRH analog, right? So again, it mimics what we do in the brain. And the dosing for samoralin is 500 micrograms twice a day, 5 days on, 2 days off. Now, tesamoralin, this is actually already an FDA-approved drug specifically for a medical condition called lipodystrophy in AIDS patients, where they essentially develop more abdominal fat. And we know how deleterious to our health having additional abdominal fat is. And so tesamoralin is very powerful at helping AIDS patients with lipodystrophy. But in the anti-aging space, tesamoralin is a game changer and a powerful aid at optimizing growth hormone levels and decreasing belly fat specifically. I will mention CJC 1295 ipamorelin, although you won't see that anymore as it has been recently added to the FDA ban list. And really, don't get me started on that. But CJC 1295 ipamorelin, 100 micrograms would be a great dose of your CJC 1295. And then you can do about 150 or so of your ipamorelin, 5 days on, 2 days off and hitting that twice a day, just like the samoralin, is also a great approach to maximizing our growth hormone levels. So growth hormone peptides, remember, we're talking about healing, but what's very unique about growth hormone is it's going to help promote muscle growth. It's going to increase fat loss, increase muscle growth, or protect our muscles during a fat loss program, improve quality of sleep, improve immunity and cognitive function, and of course, improve healing. So this is why they've always called it fountain of youth and why it's such a powerful tool for anti-aging and overall optimization of your health. Okay, so I want to talk about low dose naltrexone. So LDN for short is actually a drug called Naltrexone, which is FDA approved for recovering alcohol addicts or recovering opiate addicts. So why am I talking about that? LDN, or low dose naltrexone, is very popular in the anti-aging space. It's about 1/10, give or take, of the dose that you would see normally for naltrexone. Could be a little bit higher. And it's got powerful anti-inflammatory effects and immune system modulating. So the only time I would recommend it for someone looking to heal would be if they're also suffering with an autoimmune disease, if you're also suffering with inflammatory condition of some sort, and you have a nagging injury. Well, now we have a huge roadblock to healing. And so LDN can be, again, a game changer, a powerhouse. We'll link to that in the description if you guys want to get a prescription. It does require a prescription, just like all these peptides too as well. And so we got you covered. We service across the nation if you're interested. I wanted to interrupt for a quick minute. Your ultimate peptide guide is now available completely free. I'll link to it in the show notes, guys. Everything you need to know as far as implementation for your peptides and optimal health. We'll see you guys later. Now back to the show. Okay, so we got our coverage here for our autoimmune people looking to heal and inflammatory conditions. What else can we do, right? And this is where I really want to spend some time with you guys to help you maximize your results, because this is a big investment. So why wouldn't you put the effort forward? And unfortunately, when I look at other clinics and their programs, and it's just all about, here you go, here's your peptides, and that's it. and no one's coaching them and helping them achieve the best results that they can. I mean, that's always been our motto and philosophy. So let's look at local therapies, right? Because we service across the nation. We can get you your peptides across the nation, but local therapies would be the whole regenerative medicine space. So regenerative medicine is an awesome branch of medicine where we look at your body's own internal healing, platelet-rich plasma, and tissue replacement therapy. So PRP has been around for decades. And look, nobody has any issue with PRP or says it doesn't work. PRP can be used freaking in your face, in your hair, in your joints, tendonitis, wherever you put PRP, it heals. You can even use it in your penis or your vagina for sexual healing too as well. It's called a P shot and an O shot. Really, in case you didn't believe me, you should check it out. It's really cool. So PRP is awesome. And depending on your injury, most injuries, a qualified licensed healthcare practitioner can inject the PRP. So they draw your blood, they spin it down in a centrifuge, they isolate the platelets and the growth factors, and they inject it. So you're going to spend somewhere probably around $1,500, something like that, for a series of 3 injections, give or take. So it would definitely be something that I would recommend that you look at, because the healing peptides are awesome, and the healing peptides are going to have a systemic effect too as well. But let's say you have one primary injury that you are looking to really recover from. Getting some additional PRP in that area can really take you to the next level. If you have the money to make an investment, I've always been a fan of tissue replacement therapy. Before we closed down our clinics, and before we became a national provider, we have done tissue replacement and stem cell therapy for years. And I couldn't begin to tell you the plethora. I mean, just go to our YouTube page and you'll see way on the older videos how many testimonial videos we have from stem cell therapy. Very expensive, very pricey, but still an awesome, viable option, depending on the severity of your injury and depending on the amount of financial investment you want to make. Definitely finding a local licensed healthcare practitioner with good reviews, good experience, would be something to consider. Right now, but I would say for most of us, if you're going to do a powerful peptide cycle and PRP, you're probably going to be fine. All right, now let's continue to move down this list. So local manual therapies, right? So a lot of people are looking for the quick fix, and I get it. We want the powerhouse, we want the quick fix, but working with a physical therapist and or chiropractor can be a huge, huge impact for significantly less price. I mean, even if you don't have insurance coverage, you're talking about $50 to $80 a session, and you don't necessarily have to see them rigorously 2 or 3 times a week, multiple times a week, right? Obviously, if one of them tells you that and they give you a good reason and you can afford it, great. But if you can't, find someone that's willing to work with you on a more weekly basis, maybe for the first couple of weeks, and then willing to titrate down. So a physical therapist is going to focus more on the muscles. And a lot of times, even if it's joint pain, for example, the way the body works, that's a single synchronized functioning unit, and the whole body works together and has an effect like a kinetic chain. And so having muscle imbalances, for example, can many times be the source of a certain pain or a certain tendonitis, right? It puts your joint, for example, in a compromising position, and then you go work out and then you aggravate it. So a PT, for example, and chiropractors too as well, they don't just focus on just the spine. Some really good chiropractors have just as much knowledge as a PT, and vice versa too as well. But they obviously both specialize in what they specialize in. So the PT can help identify some potential muscle imbalances and give you some at-home corrective exercises that you can do for, again, like, look, if you have an injury, what is 10 minutes a day in the morning to do your rehab to get through that injury? If you're willing to spend thousands of dollars on peptides, then what the hell, man? Get off your ass and do these exercises. But you got to go take the time and find a good PT. Now, the chiro, same concept here, but this is different. So you're going to find a chiropractor that works with the spine. And while it is lesser accepted, I would say, in the medical space of what spinal work can do for extremities, I'm a doctor of chiropractic. And so maybe I'm biased, but chiropractic is phenomenal. Like anything, there are many different therapists out there, many different chiropractors. So find one that gels with you, and you can always try more than one, and see if there's anything that they have identified in your spine that they believe can then potentially help you putting your body into a position of better recovery. Okay. So this would still require you going out and seeing a licensed healthcare practitioner. Now, what can you do now? What can you do at your own? What are some of these at-home therapies? So hands down, I have to recommend knees over toes protocol. So this man right here, Mr. Ben Patrick, he is just his protocol. I'm a huge fan. I'm biased. I've used it. The results that I've gotten, I can't even begin to describe. I am jumping higher than I've ever jumped before. And I have so much more stability in my knees that this is out of control. And they don't just, the reason why I bring this up is because their platform is amazing. It's like $50 a month. You get a person that you can work with. They structure something for you. You have a whole set of programs they put you on, and then you use your phone, record yourself, get feedback from your coach. And it's, again, right now we're getting into time commitment, but you're watching this video because you were willing to put thousands of dollars. So I'm telling you, K's over T protocol is very unconventional. So you will unlikely find a PT that understands the knees over toes protocol, K over T for short. And so using both is awesome. I have learned tremendous things from K over T, but I still, when I am injured, go to a physical therapist and get a second pair of eyes and have specific recommendations. And I find myself kind of meshing both together. So cheap investment, $50 a month, do it for at least a couple months. Tell me if it doesn't change your life. Now, look, for the specific injury, they have certain protocols, but the foundation, the reason why I bring up K over T is because they have this, and this is why I love them, because they're not just looking at healing your injury. They're looking at preventing injury in the future. And they give you a foundation from the ground up, starting with your knees, but your low back, and putting your body into a much better state to where it will be more resistant to injuries in the future. So I can't stress that enough. Go check out K over T therapy. So at your house, simple investments. I'm a big fan of foam rolling, lacrosse ball rolling. So a foam roller is something that you could purchase on Amazon, and it's a big piece of foam. Here's a picture of my favorite foam roller right here, actually, because it's got a little bit more ridges on it and it gets deeper. But essentially, for some reason, there's still a debate of whether foam rolling works. I mean, I literally can't find an individual who didn't benefit from foam rolling. It improves circulation and it breaks down muscle adhesions. And as wild as your injuries may seem, you could have muscles that are not next to your injury have a big impact, and you won't know until you foam roll them, you crush them, you break them down, and then all of a sudden the joints or the areas that were bothering you, the tendonitis, for example, gets a lot better. So foam rolling, cheap. You freaking spend $10-20 on a foam roller, and it's just making a commitment and putting in time. There's a ton of videos online that you can go YouTube and find, how do I foam roll this muscle? How do I foam roll this muscle? This is where your physical therapist can give you guidance. You let him know that you have a foam roller, and you have him come up with at-home foam rolling protocols that you can adhere to. The lacrosse ball is the same concept, just there's certain areas in the body. For example, if you have stuff going on up here, like in the upper back area, it's tougher on a foam roll. Foam roller is great for the legs, for the lats. The lacrosse ball can be good for piriformis on the glutes, or that upper back area, kind of scapular. So I personally right now I'm using a foam roller because I have some issues with my right shoulder, and I've already noticed the improvements from the lacrosse ball movements that I'm doing. Okay, so I want to talk about floss bands now. Now, I learned about floss bands from K over T therapy, full disclosure, but floss bands are available. Here's a great picture of what they look like. They're essentially big rubber bands, and you wrap them around a joint. So this is a great picture here of what it looks like when they're fully wrapped up on the knees. And so a set of one floss band above your knee, one floss band below your knee. What that does is that wraps extremely tight, and it holds down to where the muscles, that tendinous injunction, hold it in place, so that you'll notice immediately your range of motion, your pain-free range of motion, increases dramatically. And we know that blood flow and circulation is one of the important keys to healing through injuries. And so floss bands are phenomenal. I know when I first saw them, I was like, what? I never heard of them, and didn't think it would make that much of a difference, but it does. Trust me. You do one massive set of some sort of movement through the range of motion that used to be painful, but isn't painful with the floss bands on. You'll notice it's pretty wild. It's going to dramatically improve blood flow, especially because it's also restricting blood flow while they're on, because you get a little bit of a dual kind of like blood flow restriction training, which is a whole other thing that people know is helpful as well. But you also have the fact that it impinges those tendons and ligaments and allows you to move through a range of motion that you couldn't otherwise do. For such a cheap investment of a couple bucks, Floss bands are amazing. You definitely want to have a pair of those around the house. Okay, so let's end this here with some additional lifestyle, focusing out of the manual therapy, right? And focusing more on your body and overall health. I can't stress this enough. Stress in your body will derail your healing. It'll flat out prevent you from healing when you have high levels of cortisol. Cortisol is that stress hormone. So stress in your life or lack of quality sleep are going to produce higher levels of cortisol, and cortisol is going to derail your ability to recover. So implementing some stress management techniques are a phenomenal investment. There are so many different stress management techniques. As you can see, a couple here. We got breath work, we got drawing, journaling, meditation, mindfulness. You have all sorts of stress management apps. Just pick one, okay? Just pick one. My favorite is breath work. Implement it as part of your bedtime routine. You can do it in the morning too. There's no bad time to do stress management technique. I mention near bedtime because part of a good night's sleep comes from having a bedtime routine. And I notice I get more relaxed, and many people do as well when they do their stress management techniques. So you're kind of killing two birds with one stone there. Moving on to sleep. 7 to 9 hours of quality sleep is mandatory. You have to listen to your body and be honest with yourself and figure out what amount of sleep is ideal for you and strive to get the best level of sleep that you possibly can. So I'm going to go over some tips and tricks that you can do to change your environment, to develop these new habits and improve your quality of sleep. Number one, we want to sleep by a schedule. So your body has a powerful circadian rhythm. And with that circadian rhythm, which is like an internal clock, it appreciates and respects schedules. So going to sleep on a schedule, waking up on a schedule, right now, from the most recent studies that have been done around sleep health and sleep hygiene, this is the most powerful thing you can do. So me personally, I go to bed 10 and I'm up at 6. This is 7 days a week. For a while in my life, I was doing the 5 days thing, and then I'd stay up a little bit later on Friday night, Saturday night. And, I don't drink much. Alcohol is a whole other conversation very quickly. There's no room for alcohol when you're trying to heal. Like, I don't think I need a whole section on that. But even sleeping off schedule will impact your body's ability to get quality sleep. So get used to a schedule, develop that schedule, makes a huge difference. Number two, dimming the lights. So I have an alarm set on my phone at 8 p.m. every night. And that alarm is great because I'm usually knee deep into something and it goes off and I go, great, it's time to start prepping my body for sleep. So I walk around the house, I turn off all the lights, and then I dim the lights in areas where I still need light. In this case, bathroom, bedroom, kitchen, and office, because that's usually where you're going to find me at 8 o'clock. It's still working away, at least these last couple of years, in my office. Then in areas where you still need light, if you're not lucky enough or able to get a light that dims, this is where you can get on Amazon, you can buy a little $20 light fixture and get yourself a $15, $20 light bulb that is very low on the flux reading. It's called a low flux light bulb, or red light bulb, red incandescent bulb too as well. What this is all doing is minimizing your exposure to blue light. Blue light is a spectrum of light which inhibits the production of melatonin, and you need a high level of melatonin being produced to prep the body and continue to get into some deep quality sleep. So get this routine started. Dim the lights before you go to bed. Finally, when you go to bed, now we want to finish that off and completely block off 100% of your light. So if you have to have an eye mask at the end of the day, this is an easy way to do that. But if you don't need an eye mask, if you can actually block off 100% of light in your bedroom, blackout curtains, moving all the devices, turning them off completely, and moving devices out of the way if the light has to stay on, covering your phone, putting it away so the light doesn't stay on, doing everything you can is going to make a huge difference. Okay. Number 3, cool it off, reducing temperature in your house. So the temperature, my AC unit for the house starts to lower around 8 o'clock, and I'm lowering the temperature in the house. Now, if you're unfortunate in a situation where you can't lower the temperature of the whole house for whatever reason, it's really just the bedroom. So figure out a way to get your bedroom colder. 65 to 68 degrees is ideal. Personally, I sleep at 61, and I know that's crazy, but that's just my body. I noticed that anything warmer, I'm not getting as much good quality sleep. And so 61 degrees, thank God my girlfriend's very nice and has adapted to this to this more chilly environment. We're actually going to get out and get this really awesome sleep bed thing. And, I'll show you guys when I get it, but this will allow me to not have the temperature so low in the house for her. And then I can have a bed that cools itself. There's many devices out there, devices that you can sleep on, that you put over your sheets, a local AC unit in your room, whatever it is, make this investment, get it done. You will get better sleep. The next thing is the association, the relationship that you make with your bed. Your mind has a strong associative relationship that it develops with your bed. The more time that you spend in your bed not sleeping, the greater the likelihood that your body gets accustomed to that and gets used to that. So really respect your bed as the place that you sleep, and that's primarily what you do. And then find some other cozy, comfortable area for the pre-time, or maybe where you want to lounge on the weekends. You just go lounge away from the bed. Keep that relationship that your kids, notice how your kids, did they hang out on the bed? No. They go to bed, they go to sleep, and when they're up, they're out. That same kind of framework is how you want to approach this relationship with your bed. It will make a big difference. So alcohol, caffeine, there's no room for alcohol in anyone's healthy lifestyle. Understand that even a single drink in the day will decrease your quality of sleep. Now, caffeine, about 10 hours prior to your bedtime, you will still notice that. You may even have no problem falling asleep and staying asleep. But what caffeine does is disrupt the sleep architecture, meaning that even if you are asleep the entire night, you're not getting as restorative sleep as you could be otherwise. So really cut off your caffeine intake as we get closer. 10 hours is so I shouldn't say as we get closer, but as we get into that 10-hour pre. So for me, it's about noon to 1. That's when I have my last cup of coffee if I feel like I need it. Okay, so reducing inflammation is going to improve the outcome of the peptides and the outcome of your body's ability to heal. And so looking at your diet, looking at your nutrition, how close to an anti-inflammatory diet are you really consuming? So anti-inflammatory diets, you can Google them. They're essentially just a more restricted, very restrictive diet. I get it. Ask yourself how important it is to get your healing. Give yourself 3 months. That's it. I don't need you to follow an anti-inflammatory diet if you can't, if it doesn't seem sustainable. I help patients with lasting weight loss. So sustainability for weight loss is a big deal. So I usually don't tell them to do this, but for injuries, if you can commit to 3 months of following a more anti-inflammatory diet, you will very likely heal faster. So take that for what it is, but that can impact your healing and improve your investment that you're looking at making. Finally, a supplement protocol. So I'll link to the optimal supplements. In that free guide that I mentioned, there's going to be all the supplements and all this great information for you. So you're definitely going to want to get that. But with specific supplementations, hands down, the most powerful anti-inflammatory supplements that you can get are a high quality curcumin and resveratrol supplement. And so I'll link to my favorite brands, but getting a good dose of that, then you can even go, especially with an acute injury, you can really dose that curcumin higher using diarrhea as an indicator that you probably need to back off a little bit. But the presence of both of those together are a very powerful anti-inflammatory combination. So utilize that, get your healing in, and watch yourself get back to recovery and enjoy that quality of life. Guys, peptides are amazing and you won't be let down. If you guys enjoyed watching this video, you're definitely going to want to check this one out here, Peptides 101. This is the most comprehensive and practical guide that you will find regarding peptide therapy. So definitely check that out. You're not going to want to miss it, and we'll see you guys later.